So thanks so much for joining us today. My name is Dr. Shawn Whatley, and I'm the president of the Ontario Medical Association. I'm here today on behalf of 40,000 physicians who see 320,000 patients every single day in Ontario. And I'm here to make sure that healthcare is made a priority for every single MPP and each political party leading up to the election in June. For healthcare in Ontario, this is perhaps the most important election in a generation. There is no time for delay or mistake. The next government will have to deal with the urgent problems our patients face every day. Many patients in Ontario are facing unacceptably long wait times for access to tests, specialists, and treatment. For example, more than 12,000 children and youth are waiting up to 18 months for mental health care services. Some patients wait up to 6 days for an acute care bed, a mental health bed in an acute care hospital. And those days are spent in the emergency department. Noisy, no privacy, no peace. According to Health Quality Ontario, the current wait time for long-term care beds in Ontario is 149 days. In some communities, such as Ottawa, the wait is up to 2.5 years. If we look to the north, many patients in Northern Ontario must travel to larger cities for care. For example, folks in Kenora have to travel to Toronto to see specialists. It's easily a 24-hour drive. Our population is aging. By 2041, 1 in 4 Ontarians will be over the age of 65. This means we must fix our system now. Government simply doesn't have an option to not work with those of us on the front lines of care, those of us who see what patients need every single day. We must work together to find real, tangible solutions to these problems. As I mentioned, Ontario doctors treat 320,000 patients every single day. We operate with scarce resources in a broken healthcare system, and yet we continue to make a positive difference in the lives of our patients by providing high-quality care. You know, our great province is fortunate to have outstanding doctors, nurses, and healthcare providers. Ontario doctors want to make a concrete change. We spend every single day trying to provide high-quality care, and we need to have a working relationship to make that happen. So the problem is not the care that we have, it's the care that we have to wait for, and that's why I'm here today. I'm bringing these concerns to each and every MPP with our priorities document. We have them individualized for each MPP. We want to show how important it is that these issues are addressed by the government, working with Ontario's doctors to improve healthcare in our province.